welcome to today's video. My name is Mr. Cates, and it once again brings you to RT World. And what brings you here today is sputum analysis and characteristics. It's a great video today for a respiratory therapist, and we're really going to focus. There's a lot of information on the screen right now, and I really need you to unpack, and we're going to go through this all on today's video, but really just focus over here. And what we're going to look at today on sputum analysis and characteristics, right? So this is what we're going to analyze, or we're going to run an analysis on our sputum. We're also going to look at some characteristics and maybe leading us to pass, right? At the end, we're trying to solve a puzzle here. What's going on with this patient? What are they representing? What are we seeing when we take this sputum culture, right? And we're going to talk about some of these things. First thing I want you to do whenever we do a sputum analysis, or we're trying to get some characteristics, right? And this could be for charting, this could be lab, this could be all things, right? All inclusive test taking, as all things RT. That's the only thing I say here is this is all RT world right here. So the things I want you to focus on in today's lesson is these things right up here. The first things I want you to focus are amount, consistency, and color. Right? So whenever we get our sputum, we need to first identify the amount of the sputum we got back. We also we want to go over the consistency, and then we also want to identify the color. And those three things are all huge pieces of information. We don't want to leave out any of those things. So what are we talking about here? And I transfer that same three things right over here. You see amount, consistency, and color. Well, we're going to start with amount right up the top, right? And so when we talk about amount, what are we talking about? Well, we're using descriptive language like small, right? Moderate amount of secretions. We have a small amount of secretions, a moderate amount, and then obviously we have a large, right? And another word that you'll see is copious. And I really just think of this as like copies upon copies, but it's called copious, right? It's just reproducing the same thing over and over and over. It's there, it's not going away, it's copious. It's just keeps coming back, right? Small, moderate, large, you're talking about the amount of sputum that you're able to get from the patient, or what you got from the patient. All right. Next is consistency. And consistency, the descriptive terms would be thin, right? And we say thick, okay? We also use words like tenacious, okay? Those are some descriptive words on consistency, right? Small, thick, and then the color. Small, tenacious, or copious, tenacious, thin, small, you get the picture. We want these three things. What are they? Amount, consistency, and color. Well, we know we got amount, and as we get more, maybe there's something going on. If it's thicker, if it's tenacious, if thin, all telling us something about the picture that we got, or we're trying to paint this picture. All right, now this is, if not, one of the most important things right here, and that is color. Color tells you so much about your sputum, okay? And right here, the first one we got is clear. Well, clear, guys, we have a small, thin, clear secretions. Normal. Moderate, right? Amount, maybe on a day. But when we see clear, or we think of clear, and we see that, we're thinking of normal, guys. Normal for the color of clear. All right? Mucoid, that's next. That is your white, okay? Or your gray, okay? Your white or your gray color, okay? We're just talking about color right now, right? Normal for clear. This one's going to be white or gray, okay? The next one is yellow, okay? We also, this yellow to green, okay, this is what they tell you is yellow, okay? We're going to associate mucoid, okay, we'll go back and we'll say this. This one, they usually use this one for chronic bronchitis, okay? And that's for this one here, mucoid. And for yellow, okay, yellow, they are now going to say this is a what? This is an infection, okay? That's an infection, okay? Okay, green. And we're getting to green here. And this is stagnant sputum, guys. So yellow converts to the green. And we're looking at this one. This one right here, guys, is very identifiable, and that's why I'm writing this down. This is a gram negative. Okay, and what they're leading you to is bronchiectasis. Okay. Okay. Or what is this? Pseudomonas. You guys need to know these names. If you see this, green, gram negative, okay? Gram negative, bronchiectasis, Pseudomonas. Gotta put those in. If it's green, you're going down this path here. Infection, right? Yellow, most often it's bacterial. That's another video. We'll distinguish how we get to that. But that's going to be here, right, for this one. And then for the mucoid, white, gray, yellow is already descriptive. Green is already there. White or gray, they're kind of leading you to bronchitis, chronic bronchitis. If it's yellow, bacterial infection. If it's green, gram negative, bronchiectasis, Pseudomonas. You see what I'm saying? If you see these colors and they come up, and then this is how you chart and you see that, but this will tell you if it's, you know, how active, what we are, consistency, amount. This one's getting now descriptive and color, leading us to these areas here we need to focus on. Okay, now we look at brown. Brown, guys, this one's old blood. Okay, so this one would be like a old, or you know, something that's old blood, dark brown. We'll get that. Bright red, this is what they call, okay, hemoptysis. Okay, this is also frank. You'll see frank, like the name. That's bright red, guys. Bright red, hemoptysis or frank. Okay, active bleed. Active bleeding, guys. It's not old, it's new because it's bright. Dark or brown, it's old blood. Dark red, or not dark red, but bright red, hemoptysis or frank. These are descriptive terms. Frank color meaning that is bright red. There's something actively going on. We need to know that. It's not an old issue, there's something going on. Okay? Pink frothy. Well, we need to just put that down now. That's pulmonary edema, guys. Pink frothy secretions, pulmonary edema, CHF, stuff like that. Pulmonary edema, pink frothy secretions. You see that come up, or you read that in descriptive terms, they're leading you for that CHF or pulmonary edema. Look for one of those. All right? So just to add on to this a little bit more, because this is we're already done. We're already 1, 2, 3. You can do this every time. You look, you observe, you get an analysis, and you get a characteristic of your sputum. And this should give you every time you use this format. 1, 2, 3, come down. You kind of see what you need to do, right? Well, there is a little breakdown to this, and we're not done yet with the first top half here, the 1, 2, 3. And just kind of giving you a representation, because not all the times you see yellow, green, and mucoid, stuff like that, right? So what you might see, and I'm going to give you this little color chart up here, and you'll see mucoid, right? We see that white or gray. You see that right here? Okay? Mucopertinent. We talked about this. This is mucus, right? Or white, gray mixed with yellow. So it's secretions mixed with something yellow, infection, something going on. You look like this, okay? Pertinence. Oh, this is where we got to really look at pertinent is. And we talked about that. What is that? It's dark yellow or green. So that puts us right over here, guys. See green to yellow? Well, if I see it's pertinent, all right? You see how pertinent right here, and you see severe. So mild, this is on our severity chart. You see mucoid, right? This kind of goes down. Look, clear, normal, gray, yellow to green. That is your pertinent to severe. You see that, guys? And now, if it is severe or in this category right in here, pertinent, that you see, greenish to yellow, dark yellow, right? We are already looking at bronchiectasis, Pseudomonas, but these are changeable, right? Interchangeable. Pertinent means what? Dark yellow or green. So we can put pertinent, right? Dark yellow to green. That puts us right here, guys. So if you see this pertinent, that descriptive term, you're right in there. So I'm going to keep this and I'm going to minimize it right now so you can just see. Now we're looking at infection, but if it's green side, bronchiectasis, Pseudomonas. And if we're up here, we're kind of leaning to a bacterial infection, more yellowish. But these descriptive words, pertinent, dark yellow to green, falls right in here. All right? So we are just covered the 1, 2, 3 of sputum analysis and characteristics. Now, I do want to touch a little bit more on this before we just say we're complete, right? Because there is some stuff that gets added on to our sputum analysis, right? We talked about really the characteristics, but let's go over here. And we see these things written right here. Sputum culture, sensitivity, Gram stain, and acid fast stain. Well, I just want to highlight a few things over here, okay? So when we highlight this is sputum culture, okay? Sputum culture, first thing right here, right? Now, this one, what does this do? When we do a sputum culture, this one is going to what? It's going to identify, right? Bacterial infection. Okay? So, sputum culture, we send that in, and we now are going to identify if there's a bacterial infection going on. That's what we want to know. So we get a culture, we'll send it to the lab, they culture it. Now they'll tell you what, if there is, or what type of bacterial infection is happening. The one caveat to this, and really got to call this out, is it takes a while. 48 to 72 hours for results. So it's not a rapid, we don't get rapid results in this. So if we need answers right away, sputum culture is 48 to 72 hours for results. All right? So we got to make sure that we know our time game here. What's our time frame? Is this an emergent or what's going on? Do we send in a culture when we need something right away? Well, we must understand it's 48 to 72 hours for results. Next thing up here is sensitivity. So once we identified with our culture if there is a bacterial infection and what bacterial infection it actually was, then we put it up to what? Antibiotics. Antibiotics, and let me, got a little, there you go. Okay, antibiotics, guys. Sorry to get you. I got a little brain, lost here. So antibiotics, okay. So going back on this, and this is will kill, right? Bacteria, or the bacteria. Okay. So sensitivity, guys. We cultured it. Now we need to identify what the bacteria, if it was, right? Then we go to what's it sensitive to, what that culture we just got. We identify the bacteria. Now what antibiotics will kill the bacteria? That's the sensitivity. But there's a catch to this one too. It's exactly the same amount of time, guys. 48 to 72 hours for results, not a quick get your results back. Sensitivity, same thing, only need to remember it, 48 to 72 hours, okay? Gram stain. Now, what a gram stain does, this is only going to identify if this is a negative or a positive, right? When you gram stain it, now you're going to be able to identify whether the bacteria is a positive, a gram positive, or a gram negative. That's what a gram stain. Is your bacteria a gram stain positive or gram stain negative? That's what you're identifying here. And on this one takes about 1 hour to get results. 1 hour to get results to find out if it's a negative or positive bacteria. All right, and then we're at our last, which is our acid fast stain, right? And this one solely, guys, what you need to do is just mark this down solely for TB. Okay? This acid fast stain only identifies, right, Mycobacterium tuberculosis, your TB, guys. This is what your acid fast stain, all right? So if you see acid fast stain or you're trying to rule out or identify TB, that's when you select your acid fast stain or you want to obtain one, all right? So again, thank you once again for watching this video. I'm letting you guys know this is RT driven. This is our world, sputum, right? This is why we're up here. We're suctioning. We're looking at these things daily. And if we have a good understanding, we can see, right? If we get something yellow, we know we might be running into a bacterial infection. So let's get that sputum. Let's get it cultured. Let's get some sensitivity. What we can combat that with are therapeutic methods after this, right? We can do our gram stain acid fast if we're leading down that road to TB, or gram stain negative or positive. We want to see what's going on. And all things, right? All things, right? But you can see something so small, we should really need to know. We're the experts in this area, and we really need to dial this in. So watch this video as much as you want. Go over and over with this video, because when you get this stuff down, you are a true respiratory therapist. So have a great rest of your day. Look forward to seeing you in the next video.